This is November of 1975, about a year before the Dr. Everett Chalmers Hospital officially opened to patients. Half a century later, the city has long outgrown the building.
We have patients that are within hallways, within waiting rooms, within family rooms, and other locations. None of these locations is ideal.
Horizon Health has been under fire for having to resort to the hospital's ambulance bay for extra space. 13 beds were created in the garage where there's no running water or proper washrooms. Now the network is promising to move those beds to another wing, but not before moving other services elsewhere, and so on, a complex game of dominoes.
At this point in time, we need, though, to plan realistically for how we can increase our capacity, knowing that the numbers of these patients may actually increase.
The patients she's referring to, people waiting in the hospital for a long-term care bed. Right now, 142 beds are being used by those patients. A plan for them is needed now, Richard Lossier insists.
My biggest frustration is that we don't have a bed plan. And what I mean by that is that there's no new capacity in New Brunswick right now. That's going to happen starting next year. You ask me what's the next nursing home being built there? I can't answer.
The ambulance bay will still be used for administering care. Plans are to turn it into an extension of the emergency department. And while the ER needs the space, so do paramedics, says David Kuhn.
It's inhumane to unload people who are at risk of dying in the snow in the wintertime, outdoors. We need a working ambulance space.
Right now, though, it's serving the urgent need for an old hospital struggling to meet modern problems. Laura Brown, CTV News, Fredericton.